Hello everyone. Today, in the pulp space anatomy of the individual tooth, among all the tooth, we are supposed to know the anatomy of all the teeth, but then in that, the most complex and important one to understand is the maxillary and mandibular first molar. So in this session, we will discuss the root canal anatomy or the pulp space anatomy of all the maxillary molars. Maxillary molar average tooth length is 21.3 mm. Here in this picture, you can see A and E is the labial view or the buccal view, whereas B and F is the proximal view. And you can see that there's a crown with 4 cusps. We are not talking about the cusp of Caravali, but in occlusal aspect, there are 4 cusps: mesiobuccal, distobuccal, mesiopalatal, and distopalatal. The pulp chamber, which is the pulp portion which is inside the crown, also corresponds to the pulp horns correspond to these 4 cusps. So pulp chamber has a roof, floor, and 4 walls and pulp horns corresponding to these 4 cusps. It is the largest in the arch and it has the maximum volume of the pulp comparing to all other teeth. The roof is rhomboidal and the floor is triangular in cross section. As you can see in the picture, there are 3 roots, namely mesiobuccal, distobuccal, and palatal. And in maxillary first molar, there is high chances of having second canal in the mesiobuccal root, namely MB2, that you can see in the picture A. Whereas in E, we can see a variation where there are 3 roots with 3 canals without MB2. But according to literature, 84% of all the maxillary first molar has the MB2 in it, according to Grossman. And according to different other authors, it's almost about 90%, which means almost all the maxillary first molars has MB2 in it. So this is a picture of the occlusal aspect with an access cavity, and we can roughly see where are the orifices, location of the orifices present. Palatal is the largest and round. It is slightly present. The buccal groove, it is present in the mesial to the oblique ridge. And we can, if we trace the buccal groove, it is slightly present palatal to the buccal groove. Mesiobuccal is under the mesiobuccal cusp. And distobuccal is distal, slightly distal and palatal to the mesiobuccal orifices. As you can see in this picture, there is MB, DB, and palatal. And MB2 also you can locate just adjacent to the MB root. To exactly tell about the location of the MB2, it is generally present mesial to or directly on a line joining MB1 and palatal orifice. Here you can see a line connecting the MB and the palatal orifice. It will be either present on this line, just 1 or 2 mm palatal to the MB1, or it will be slightly mesial to this line. And while doing the root canal treatment for working line determination as well as for taking master cone radiographs, we can use a slide 20 distal angulation for the SLOB technique to see the MB1 and MB2 clearly separating from each other. Palatal is the largest pulp. So when we direct our burr in the access cavity preparation, usually we direct it towards the palatal so that we reach the pulp or we get the burr rock effect easily. It's a flat ribbon-like wider mesiodistally, 40% straight canal, single straight canal. There can be many variations. The palatal can split into 2, or there can be 2 orifices combining into 1, or maybe there are 2 separate canals, but these all are the minor variations. Most of the time it is a single straight canal. Distobuccal is smaller than the palatal, narrow, flattened mesiodistally. Mesiobuccal is the narrowest, flattened in the mesiodistal direction at the orifice, but round in the apical third. And MB2, whenever is present, that is the narrowest one. It can occur as a separate entity with a separate exit, or it can join in with the mesiobuccal. It has close proximity to maxillary sinus. The first premolar, second premolar, and the first molar has the most closer proximity to the maxillary sinus. Pulp stone may be present, and concavity exists on the distal aspect of mesiobuccal root. Now, when we have to discuss the maxillary second molar occlusal anatomy or the pulp canal anatomy, it is similar to the maxillary first molar. Only difference is that in the crown portion, it is narrower mesiodistally, and in the root portion, the MB2 is less frequent. The average tooth length is 21.7 mm. The pulp chamber is almost having the same shape with the floor, roof, 4 walls, and 4 pulp horns corresponding to the cusp. And there are 3 roots with 3 canals is the most common configuration. MB2 can be present, but not as frequent as present in the maxillary first molar. Maxillary second molar has 3 roots which are closely grouped. 4th canal is less frequent. And there are other variations also. If the buccal roots fuse, it can be 2 roots and 2 canals. And it can be a tooth with only 1 root with 1 conical shape root canal. These all are the other variations of maxillary second molar. Whenever 4 canals are present, the axis cavity will be rhomboidal in shape. Whenever 3 canals are present, it is triangular in shape. And when 2 canals are present, the oval shape axis cavity is sufficient to gain access to the apex of the root. Mesial margin should not be involved. The maxillary third molar, now we can't define exactly like it will have so and so anatomy. It can have maximum variation. It can range from 1 canal, or it can 1 canal splitting into different canals. There can be 2 canals or there can be 3 canals. But anatomically, it more or less resembles the second molar. And the pulp chamber may vary greatly. This may have odd-shaped chamber with 4 or 5 root canal orifices, or a conical chamber with only 1 root canal. With multiple preoperative radiographs, or when you do itself, when you will understand with the instrumentation how the configuration is. And whenever required, sometimes even we have to go for CBCT if we are not able to get an idea how the root canal anatomy is. Now we'll discuss the mandibular molars, anatomy of the mandibular molars in the next session. Thank you.